DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Folks, welcome to DocTalk. We're going to have a great show. Dr. Chris Thomsen is here. We're going to talk about health and management and raising those calves and getting them all the way to the yard, keeping them healthy, keeping them vaccinated, keeping them managed for maximum profit. Thanks for watching DocTalk. We'll be right back.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism, then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomsen here with Dr. Chris Thomsen. And Dr. Thomsen has been in practice in Southwest Kansas and feedlot, cow-calf, pretty much everything bovine.
Yep, pretty much.
And we've had the pleasure of working together throughout the years, and just really pleased and thankful to get you on the show.
Great to be here.
It's awesome. And he's a technical services veterinarian for Merck Animal Health, provides people like me with a lot of information, helps my clients, helps our veterinary practice, and so much more because of his breadth of knowledge, but also accessibility. And today, we're going to talk about raising these calves and keeping them healthy.
Perfect.
So, well, let's just get started. Where does it all start?
To me, it starts with colostrum. If you want a healthy calf, you've got to get good colostrum in them. And the only way to do that is we've got to start with feeding the cows right and making sure that they've got proper nutrition, proper mineral, all that stuff. I'm sure everybody's heard a little bit about fetal programming and the effects that can have on not only calf health and performance, but also a calf's ability to have a good immune system and respond to vaccines later in life. So to me, that colostrum that we get in those calves when they're born is the most critical thing in their entire lives.
Yeah, it happens pretty fast. I mean, it's not like we're talking about, it's just a day. And man, it programs those calves for the rest of their life.
Absolutely. And everything that they get is they're going to get little bits and pieces of everything that cow has been exposed to. So that's why it's really important that we keep our cows on a good vaccination program as well, so that they can offer really good protection for those calves.
Yeah, and I hadn't really, you say that, and sometimes we forget that it's not just what the cows are exposed to in the field, but exposed to at the end of our needle as well.
Exactly. I mean, not just scours vaccines. We think about that, especially with heifers and guys calving early in the year, in confinement and things like that. But our reproductive vaccines, IBR, BVD, things like that, that's all going to pass through colostrum as well. Even our clostridial vaccines will.
Yeah. And so then, maintaining that cow's health beyond the vaccines with the dewormers and all those, that plays its role into how much milk they produce, which then after we get past that colostrum is how well that calf's going to grow.
Absolutely. I mean, cow's got to be in good nutritional state to be able to feed that calf. I mean, that's a high demand on that cow. So we got to make sure our nutrition's in the best peak form that it can be.
Yeah. And so then as we start to grow that calf, we come into what we would call our branding season, correct?
Yep.
And roughly what age are we thinking about branding calves?
Everybody's a little different. I would say the young end is probably 30 days on up to about 90 days is pretty typical. A lot of times in that 45 to 60-day window is when a lot of it happens.
And so, as we time this, that's also another thing you don't think about with calf health is having that tight calving window. So a lot of them hit that slot so the vaccines are effective.
Yep, absolutely. And, the biggest thing we're trying to do is we're trying to get these calves' immune systems primed while that maternal antibody is on its decline.
Yeah. Well, you've got us off to a great start. We've got these calves. When we come back, let's talk more about branding and some of the things that you would do at that time with these calves to just keep maintaining that herd health, maintaining that calf health and vigor. You're watching Doc Talk. We're sure glad you joined us. We got Dr. Chris Thomsen here, and we'll be right back after these messages.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian with Neogen, and today I wanted to talk about what it entails for a risk assessment when you're looking at developing a comprehensive biosecurity program. A comprehensive biosecurity program is vital to being able to protect the health of your herd. And so it all starts with conducting that thorough risk assessment. And that thorough risk assessment involves understanding the unique challenges that your operation faces. And so it starts with being able to just look at a premise map of your facility to understand the traffic patterns. Next, then it comes down to being able to understand the health status of your herd as well as the health status of neighboring herds. And then from there, you identify the risk events. And the risk events are things like personnel movement, vehicle traffic, feed and water supply, animal movements, things like that are risk events. And then you look at how frequent those risk events occur, because the frequency impacts the level of risk. And then the last piece of it is developing those mitigation measures in a multi-hurdle approach to be able to eliminate the possibility for disease transmission entering or exiting the operation.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomsen here with Dr. Chris Thomsen, and finally, we got another Thomsen on the show. We spell it different, but it's all the same. Tremendous veterinarian colleague that works as a technical services veterinarian for Merck Animal Health. Lots of years of practice, experience, and time in the field, which makes you extremely valuable to us veterinarians, helping us with our clients and really working through some things. And today we're talking about these calves, and you know, we've got them started, and we got up here to branding, and at that 90-day window, now we're gonna do some things.
Yep.
And so what are some things that we should be thinking about on these calves at the branding time?
Well, I think a big thing is to get our respiratory vaccines protection in there. So, IBR, BRSV, PI3, BVD, we got to get those covered. We can throw in the bacterial pathogens, Mannheimia and Pasteurella as well. Probably a good time to get started on some Clostridial protection as well. And then implanting, it's, tell you what, with the price of calves right now, it's the best return on investment you can get right now is put an implant in those suckling calves.
So let's go back, because there's a lot there.
Yep.
And let's go back to the viral vaccines, because one thing I want to be clear on is we have great intranasal products and we have great injectable products, but there is no BVD in these intranasals.
Correct. There's not. And I, the younger the calf, the more I will lean on an intranasal vaccine versus an injectable. But the BVD, the only way it's available is injectable, but there's a lot of work out there showing that an injectable modified live BVD, a calf can respond to that even in the face of good maternal antibody. Yeah. So, when we need that BVD protection, we can get it in there with an injection.
And I just don't want people to be confused thinking, well, if I gave them an intranasal, I covered for it.
Yep.
Because if it's something that people are buying these calves and we aren't seeing any BVD antigen until they get to the yard, that can be an issue.
Absolutely. It's important to get it in there in these branding age calves as well.
Yeah. And so then as we start to think about the implant, and I don't want to belittle the other things, but the amount of money of a increase in average daily gain or an extra 10, 20, 25 pounds on a calf when you sell it is big money these days.
It is. I mean, you know, your calf foot implants like Ralgro, you're talking on average 23 pounds. And, you know, 5-weight calves right now are what, $4 a pound?
Yeah.
That's pretty darn good. It's over 40-to-1 return on your investment right now.
Yeah. And so, you know, what amazed me about y'all did that great work with Superior Livestock.
Mm-hmm.
And what amazed me was that there were so many people out there that weren't implanting,
Yep.
but yet weren't selling to some sort of specialty market that required you to not implant.
Absolutely. I mean, the biggest hurdle we have is non-use of implants right now in the suckling calves. There's a lot of them that could be implanted that aren't in a program that forbids it. And with the kind of money we're talking about right now, I think it's in most producers' best interest to go ahead and implant those calves.
And at that point in time, we don't cause damage to the reproducing heifer.
Nope, absolutely not. If we give one calf foot implant to a suckling heifer calf, it's not going to affect her future fertility at all.
And so steers and heifers, and now if you know you're going to keep them, probably no need.
Doesn't matter.
But if you don't know and you know you're going to sell them as calves,
Yep.
Get them implanted.
Absolutely. Don't leave money on the table.
Don't implant a bull calf.
No, don't do that.
Don't do that either. But great information, great knowledge here. We're going to take a break and we come back more with Dr. Chris Thomsen.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome back to DocTalk. Dr. Dan Thomsen here with Dr. Chris Thomsen. Dr. Chris is a veterinarian. He's a technical services veterinarian from Merck Animal Health. He spent time in private practice in feed yards, cow-calf, many different operations, and is just a wealth of knowledge for us, our practice, the PAC group, and much more. We've had a lot of fun working on different projects throughout the years and a lot of different people's herds and helping them out and serving. And Dr. Thomsen is just a tremendous servant leader. When we're talking about, we've got them started, colostrum, branding, now we're going to precondition these calves. So kind of talk me through what your preconditioning program looks like.
There's a lot of different options when preconditioning, but the basic premise is getting those calves ready for the next stage of their life. You know, if we're selling calves at weaning, you know, right off the cow, to me, that's, you know, getting some vaccines in those calves, you know, somewhere in that 3 to 6 weeks before we wean, just so they have time to respond to those vaccines while they're in a low stress environment on those cows. Making sure we've got mineral in front of them, making sure they're eating good. If they're just grazing with their mom, fine. If we have an opportunity to introduce them to a feed bunk or an automatic water, wonderful. Those are little things we can do to help get them ready for the next stage of their life. If you're going to wean those cattle at home, we can look at some different things there, as far as like low stress weaning strategies, using fence line weaning or nose flaps or something like that can make a big difference on how those calves start on feed.
Yeah, and you know, there's maternal separation, and then there's learning everything they got to learn. And so it's a, you know, I always tell people, I said, you know, compared to a pig or a dairy calf or a chicken or a fish, we ask that cow and that calf to spend 7 months together, and they get pretty attached to each other, taking care of each other, and so it's a big stress moment.
It is. It's hugely stressful moment, and anything we can do to decrease that stress level is going to be beneficial.
Yeah.
You know, and that starts with our low stress cattle handling.
Yes.
You know, taking care of those cattle, doing everything the right way is going to make it easier on them.
Yep. Facilities, talking to everybody, laying down the law before you start working of how we're going to treat our cattle.
Yes.
Is extremely important. So now let's, you know, we get one into the chute. What are some things that we're thinking about as far as, you know, product placement with these calves?
You know, we kind of laid the groundwork at branding, getting an initial vaccine in them. Hopefully we created some immune memory at that point. So now that when we come back and repeat, you know, similar antigens in our vaccines, we'll get a much stronger response to the vaccines this time. Of course, these older calves, I'm going to stick with all injectable vaccines more than likely. Our duration of immunity is going to be longer. And it's just a whole lot easier not to have to mess with the nose on these bigger calves.
Yeah. So viral and bacterial, respiratory, you know, clostridial, and really, don't you just kind of follow what some of these programs too, and working with your local veterinarian?
Yep. I mean, I always just defer to the local vet. They're the experts on what's going on in the area. You know, the other thing I'll add is probably a good time to deworm these cattle. You know, clean out the parasites that they picked up over the summer. And, you know, if you're going to hold them for another 3 to 6 weeks, that might pay off pretty well.
It does. It pays off extremely well. We're going to take a break. When we come back, we're going to wrap up getting these calves ready and out the door with Dr. Chris Thomsen.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Folks, welcome back to DocTalk. Dr. Dan Thomsen with Dr. Chris Thomsen, technical services veterinarian from Merck Animal Health. Great resource if you live in that South Dakota, Minnesota. You kind of cover all over, don't you?
Yeah, North and South Dakota, Wyoming, Montana. It's where I spend probably most of my time.
Great source of information in that area. And obviously we use him in our practice, Kansas and Nebraska as well. But you know, today we're talking about starting calves, and we've gotten these calves from birth all the way to preconditioning. And I think it's important to people. We talked about how much an implant, so there's 20, 40, 80 bucks.
Yeah, probably close to 80 in this day and age.
80 bucks. You know, deworming, that's another, it could be another 20 pounds potentially while you precondition.
Yep.
Over not deworming. So there's another 60 to 80 bucks. And now we're talking about getting a premium for following through and having these calves preconditioned. What have you all seen with the Superior livestock?
So when we analyzed the Superior data, and last year there was over 850,000 calves in this data set, getting 2 rounds of shots before weaning and selling right off the cow versus just 1 round of shots like at branding pays probably 15 bucks a head. So just for giving that second set of shots, somewhere in that 2 to 6 week before weaning, it's going to pay you an extra 15 bucks a head to do that. So it's real money.
Yeah, I mean it's all starting to add up.
Yep.
But what if we wait, even feed them even longer?
So if we take this a step further and decide to wean these calves, which from an animal health standpoint, I think it's the best thing in the world. If we can wean them at home, get them used to feeding water, get them eating good before we ship them down south to you guys to the feed yards, they're going to give you guys less problems. But if we wean those calves at home for 45 days, we're 48 to 50 bucks a head premium on those calves. So it's better for the cattle and it pays pretty well on top of it.
And we know that premium, if we didn't know that there was an advantage, people wouldn't be paying that.
Absolutely. Absolutely. I mean, I know from my time in the feed yard, and you see it all the time still, the calves that come in that are already weaned, know how to eat out of a feed bunk, they know what feed is, they know what an automatic waterer is, they start way better than balling calves do.
Yeah, and anybody that's ever told me, no, there's no difference between these and these hadn't done it.
Absolutely.
So, I'm just going to tell you, it's the difference, in a night and day difference. But as we just walked through a lot of information, folks, from Dr. Thomsen. But if you're going to kind of recap from birth to getting them out of the front gate, what are kind of your highlights?
I think the biggest thing is it all starts with colostrum. So we got to take care of that cow. We got to make sure her nutrition's in place, she's vaccinated well, so that she can give that calf colostrum. That colostrum will set the stage for that calf's ability to thrive and reach its genetic potential right there from the get-go. And then when we do these other little things along the way, give our vaccines in a timely manner, deworm when we need to, take advantage of implants, ideally weaning calves at home, it's going to pay big dividends for both the cow-calf guy and the next stage of production.
That's great. We appreciate you being on the show. We know you're busy. Thanks for coming.
Pleasure being here.
Thank you for watching DocTalk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomsen, here with Dr. Chris Thomsen, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from a few different companies here and there, but we started working with Bimeda. What I like about working with Bimeda is our rep. He seems like he's just one of us. He knows, he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Macrocin last July, and we're using it as our first poll treatment. The data shows that success rates on BRD, they're equivalent to the other macrolides that we were using. We just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a, first pull treatment. It's what really jumped out to us working with Bimeda, meeting with the rep. Macrosyn's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. That's something we really focus on, but when you've got a product like a Macrosyn, it's just another assurance, protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proven that they're doing the job for us.